We are Aspire, Alliance to Solve PANDAS and Immune-Related Encephalopathies. We work to spread awareness and education and understanding of PANDAS, not only on a national level, but we also try to provide critical support to all members of our community. So really, we have a pretty broad spectrum of who we try to reach on the daily basis, not only the general public, but families, schools, legislators, and our providers and researchers. So we have programs for all of them. Sometimes there's a lot of overlap in the information we provide, but then there are certain things we do that are fairly targeted. So we have our website, we have webinars like this, we have more handouts than I can keep track of some days. We have a new school one. We combined a couple of the others so people could sort of just have everything in one place versus pulling it from 3 different toolkits. And we work with a lot of state groups trying to work on legislation, and we provide a lot of behind the scenes work with researchers and providers, along with the sort of the bigger things like the grand rounds, which we are planning a bunch for the fall and next year. And of course, we have our webinars now, which have really gone very well. And we schedule 1 to 2 a month with different topics. We focus on treatment and scientific updates, behavioral health, integrative medicine, school support, and of course, family and patient support. And so today's lecture is obviously about school, but it's really focused on the parents and working on getting either 504 plans or IEP for their kiddos. So it kind of falls into that family and patient support category as well. So today we have our friend Shara Virlan. She is an education specialist in Wisconsin, and she is a PANDAS mom. So she's been in the weeds with all of us and knows the ins and outs. So she knows everything from working on the school side as an educator and a reading specialist to working with the school on trying to get the 504 or IEP or working towards homeschool and things like that. And she runs a Facebook page that supports the schools. She has lots of different posts every day on accommodations and all those things you need for PANS. And she's worked with us at Aspire in our treating PANS at school section, specifically in these articles that I highlighted, general special education articles and sample letters, and they're a really wonderful accompaniment to what she's going to talk about today. And then hopefully she'll come back and talk more PANS specific stuff another day. But these are a great tool for you to be able to look at every day, and they're up on the website. So without further ado, I'm going to stop sharing my screen to allow for Shara to share hers.
So thank you for inviting me to present today. My presentation, as Gabriella was talking about, kind of stems from my experience as an educator and going through the 504 and IEP process as a teacher and as a parent. And I know navigating the special education process can be difficult. It's consuming, very time consuming, confusing, and sometimes emotional. And there's also sometimes these terms that you've never heard of, we're not privy to in our everyday lives, like IEPs, 504s, FAPE, modifications, and accommodations. So it's great you're here today. And hopefully you'll learn a little bit more about special education by the end of this. Our outline today, we'll first start and talk about when to ask for an evaluation for special education, the basics of a 504 plan, and an IEP, or the Individualized Education Plan. We'll go over tips for navigating the 504 and IEP process. We'll then get into qualifying impairments of a 504 plan and an IEP. At the end, I'll give you a sample letter that you can send to any of the educational staff to ask for this evaluation. So when do you decide to ask for a special education evaluation? First, as parents or caregivers, you may have a gut feeling your child needs more support. This is really all the reason you need to ask for an evaluation. However, there are a few more indicators to push you towards asking for an evaluation for special education. Maybe your child's teacher is calling or emailing you more than the usual or more than before. Maybe you notice your child's basic needs are unmet. For example, our daughter wasn't eating lunch, she wasn't using the bathroom, she wasn't drinking the water bottle that we were sending with her. Another example may be an uptick in behavior at home or even at school. You may also notice academic concerns like difficulty with spelling, writing and math and reading, but it was a skill that they were doing fine with before, and now all of a sudden they're regressing. Maybe they have a reduced drawing ability or writing ability. Maybe they're having difficulty maintaining focus or making decisions. There's maybe avoidance or refusal of schoolwork or activities. There could be difficulty with working memory, like mental math, verbal directions, and multi-step directions. So these will all push you towards, I need to move on with the special education evaluation. Another clue would be needing, maybe they're having reduced attention span. You may observe excessive energy. They may fidget, they may have poor impulse control, and they can be easily distracted. So next, your child may have social difficulties. They may have difficulties maintaining friendships. Your child can be, easily agitated by their peers. Another clue, it may be time for an evaluation, is your child is struggling to maintain homework or is overly stressed by the work. And this may be an indicator of what is happening in the classroom and it's spilling over into your home. Lastly, many of our PANS and PANDAS kids put forth such great effort to maintain focus and act the norm while in school. And when they get home, you may witness that effect of their effort. It could just be too much, and they need to release themselves in a trusted, safe environment, which is you and your home. Okay, so does your child's PANS and PANDAS impact their education functionally? We want to think about their coping skills, their social skills, and their executive functioning skills. And if you remember from the past lecture, executive functioning really allows us to think before we act and consider our consequences. Does your PANS and PANDAS, does it impact them functionally or academically? So we think about math, writing, and reading. If your child's PANS and PANDAS does not have these impacts, then a 504 plan is not needed. If you're thinking, yes, it does, now think about the support that they need. Do they need support that provides equal access to the learning in the general education setting, but not modifications to the curriculum or the expectations or the setting? Then they may only need a 504 plan. Or does your child need not only support plus needs to be taught skills and strategies that may require the curriculum, the expectations, or the setting to be modified to make progress? If so, then they may need an IEP. But of course, you as a parent will not decide whether they need a 504 or an IEP. That will come out through the assessments and the data. So if you've decided your child needs either a 504 or an IEP plan, the next step is to formally request for a special education evaluation. What you will do first is you will send a written request, and this can be an email. It can also be a letter if you feel more comfortable. If you do email, make sure to CC your child's classroom teacher. You can send this email to the principal, to the school psychologist, to the special ed director. And all of these staff, they're mandated to respond and follow due process. And when we talk about due process, every school district has maybe something just a little bit different, but districts will have policies and procedures to be implemented for children in special education programs, and they help facilitate appropriate decision making. And then once you send this letter, an initial meeting will be scheduled, and you will be invited along with other educators as a team. And so some of the people that might be on this team will be, of course, you, the principal, the classroom teachers, and other personnel like the school counselor might be asked to come, maybe the school nurse, the psychologist, or the social worker. And usually the school psychologist is who's the one that leads these meetings. So now you've requested a special ed education evaluation with your letter. Before the evaluation occurs, it is helpful to have some background information. So what is a 504 plan? First, the 504 plan is a civil rights law under Section 504 of the Rehabilitation Act. It was created to prevent discrimination by protecting children with disabilities in our schools. It really is an access document. It gives access to a learning environment with reasonable accommodations. It's appropriate for students who need accommodations to the classroom environment and curriculum, but do not need a modified placement or a modified curriculum. It helps children access the material the same way that their peers can. So basically puts into place whatever support the child needs in the general education classroom so they can learn just like everybody else. It does not change the curriculum. Okay, so let's look at the slide. To qualify for a 504 plan, the impairment or disability must substantially limit must substantially limit one or more of the following major life activities. So let's look at those. We have walking. If you think about walking, my child had difficulties with balance and she used to have an abnormal gait. So sometimes she would hit her head often or fell sometimes. Tics can also affect our walking. Eating. Is your child eating and drinking at school or even at home? Do they have fear of contamination or choking? Those kinds of things. Do they restrict their eating? Sleeping. Our PANS and PANDAS kids may not sleep well due to night terrors, lack of REM sleep, maybe separation anxiety, long time bedtime rituals, which will affect school for sure. Their ability to communicate. Some PANS and PANDAS kids are nonverbal or their tics present challenges to normal speaking patterns. Read, concentrate, think, or learn. Learning is clearly affected. A lot of our kids will have memory loss, regression in skills that were once proficient. Processing of information may be delayed. We know a lot of our children have challenges with executive functioning skills like planning, managing time, organizing, multi-step directions, comprehension of text as a reader. Their social interactions are affected as well, and their OCD and ADHD-like symptoms can impact concentration and thinking. The next bullet says stand, bend, lift, or work. Tics can impair their ability to perform basic skills. Maybe their dysgraphia can hinder a child's ability to write. That was a lot of information. But so now ask yourself, does the disability substantially limit one or more of those major life activities that we just went through? If yes, a 504 plan should be considered when a student isn't benefiting from instruction due to their physical or mental impairment. Gabriella, you still there?
Yep.
Okay, fantastic. Okay, so how do we qualify for a 504 plan? There's two requirements. A child has any disability, and Section 504 covers a wide range of different struggles that kids can have in school. And number two, the disability must interfere with the child's ability to learn in a general education classroom. So looking at the previous slide and this slide, you can see most of our PANS and PANDAS children will qualify for a 504 plan. The goal of a 504 plan is for students to have equal access to learning as compared to their grade level peers. The goal is to remove barriers to learning and for students to be educated in the regular classrooms along with services, which we'll talk about in a little while, accommodations or educational aids they might need. I keep saying accommodations, and you'll hear this a lot in upcoming meetings as you go through the evaluation process. So accommodations are practices and procedures that provide equitable access to grade level content. So there might be accommodations in the presentation of material. There may be accommodations with response or the setting, timing, and scheduling. Accommodations are intended to reduce or eliminate the effects of the disability or language acquisition. They do not change or reduce the learning expectations. They give the child meaningful equal opportunities. And of course, they consider their functional limitations and offer different ways to show what they know. Accommodations allow the child to gain access to content and tasks. But again, they're learning the same material as their peers. So some examples of accommodations would be verbal response instead of written response. Maybe we would have less questions on assignments. There could be preferential seating. The child could then have sensory breaks. So again, the learning expectations will be the same with accommodations, but how the child gets there may be different. So if you think about eyeglasses, the glasses do not provide an unfair advantage it doesn't provide an unfair advantage to students. Rather, they allow the students with vision issues or problems to access the materials in a manner similar to their peers. And that's what accommodations really do. Some more examples of accommodations would be like testing in a quiet room or by themselves along with the teacher. Maybe instead of a regular textbook, they'd have a digital textbook. There could be a friendship groups with school counselor. Maybe there are delayed assessments while in a flare. You could put in an absence or tardiness excuse. Separate table for allergies if your PANS and PANDAS kids have allergies or eating issues. Maybe some sensory breaks or wiggle cushions, but all these things can be done in the general education classroom. The other term you'll hear a lot throughout the evaluation process is modifications. Modifications change the content or instructional level of the curriculum or test. They may reduce learning expectations. A modification alters what is expected of the student. So some examples would be the use of alternate books, pass and fail grades, specialized or alternative curricula written at a lower level. For example, when I was a teacher, I had a student with an IEP. We were all reading at the table about something with science, and they all had different levels of reading. And so did this student, even though these kids were a little bit further beyond this child had an IEP, and there's different things I had to do with this child, but we were all reading the same topic, but his was considered at a lower level, but he was able to learn right along with the rest of the kids. So now you have some knowledge of a 504 plan, some modification information and accommodations. Let's talk about IEPs. An IEP is put into place under the federal law IDEA, which stands for Individuals with Disabilities Education Act. All public schools must provide children with disabilities a free, appropriate public education, which we say FAPE, in the least restrictive environment, or LRE. A child with disabilities has an IEP to receive what is promised under federal law. So the Individualized Education Plan is a written statement for a student with a disability that is developed, reviewed, and revised by a team of people. It really is a contract between the child and the school. It outlines an entire educational plan for the student. It will first identify the present level of performance, or the PLAP, which is kind of a funny little acronym. But they'll talk about and test present level performance in academics, their social emotional skills, and physical skills. The PLAP will serve as the baseline to plan goals, services, and placement. An IEP will provide specialized instructions for students in grades K through 12. Now the 504 can actually follow them through higher education, but IEP goes through grade 12. An IEP contains learning goals based on the student's needs. So again, that'll be a modified curriculum. It describes the services a student will receive in order to progress towards learning goals. So they may need speech and language as a service, maybe audiology or transportation if there are some sort of barriers with transportation. They may need physical therapy or occupational therapy and counseling, and that can be provided within the IEP and described. It will describe the placement. Where are these goals and services that we're going to have? Where will they take place? And then participation in mainstream, that's like your general regular classroom. So if there's any sort of activities they want in the general education classroom or in mainstream, it needs to make sure that it's in the least restrictive environment. And so the team will must identify to what extent the student will participate in that general education setting. And then in an IEP, there will be a plan for standardized testing. So just also good to know with an IEP team, it can include the educational training on the child's disability. So if we want to have PANS and PANDAS education training, we can do that and put it into the IEP. Even like with reading instructions, if there's something specific for this child that they need for reading, we can put that into an IEP. Also, one little note too is that usually money cannot be a part of the decision making, but often budget does get in the way of some of these choices for an IEP. And this is where the team and its brainstorming and collaboration will serve your child best. So every child is required to have that free, appropriate public education, but we need to think about what is appropriate and what is optimal. So this can be different for different children. As an IEP team, the members need to think outside the box to meet those budgetary constraints if we really want that optimal goal. So there are 2 requirements to qualify for an IEP. The first step to determine eligibility for an IEP is through an evaluation at school. First, the child has one or more of the 13 disabilities, as you see in number 1 there. Second, the student's disability must be significant enough to affect their ability to achieve academically in a general education setting, requiring that specialized instruction to make progress. So let's look at those 13 different disability categories. And as we go through these again, they're categories, they're an umbrella, so they're not very specific. The first one is autism spectrum disorder. A student can have a dual diagnosis of PANS, PANDAS, and autism. Deafblindness, deafness, emotional disturbance. This includes many of our mental health issues like anxiety disorder, obsessive compulsive disorder, depression, schizophrenia, bipolar disorder are just some examples. Hearing impairment, intellectual disability, multiple disabilities. This one is used when a student has more than one of the disabilities in IDEA. Orthopedic impairment, other health impairment, or OHI, includes limited strength, vitality, or alertness, including heightened environmental awareness. Examples of OHI would be Tourette syndrome, rheumatic fever, ADHD, and diabetes. This is the condition most of our PANS and PANDAS students qualify under. I have a slide on this to explain the reasons why in just a minute. The next one would be specific learning disability. These would be learning challenges that affect students' ability to do math, reason, speak, read, or write. Speech and language impairment, traumatic brain injury, or visual impairment. Okay, so let's talk about the other health impairment, or OHI. So there must be evidence of the following criteria to qualify for OHI. We need to have a limited strength as indicated by an inability to perform typical tasks at school, and or limited vitality, which is shown by an inability to sustain effort or to endure throughout an activity, and or limited alertness as indicated by an inability to manage and maintain attention, to organize or attend, to prioritize environmental stimuli, including heightened alertness to environmental stimuli that results in limited alertness with respect to the educational environment. And I don't know you, when I read these, the OHI, this describes my child completely. So I got this information from the Colorado Department of Instruction, but you can find really similar descriptions at your own state's DPI websites. I changed the descriptors to show how children with PANS and PANDAS would qualify. So let's look at limited strength, which we just had talked about. It's an inability to perform typical tasks at school. So for example, child with PANS and PANDAS, they may have limited physical strength due to their condition and have difficulty with work output, mobility, and fatigue, especially during a flare, which can include swelling of joints, headaches, loss of balance, altered gait, changes in behavior, and academic performance. Limited vitality. This is an inability to sustain effort or to endure throughout an activity. Let's look at this example. Think about PANS and PANDAS children may have frequent absences from school for doctor's appointments and flares. The child may have limited cognition and stamina to attend to his or her schoolwork due to the effects of treatments and or because of our flares. Limited alertness. This is the inability to manage and maintain attention, to organize or attend, to prioritize environmental stimuli, including heightened alertness to environmental stimuli that results in limited alertness with respect to the educational environment. So for example, our children with PANS and PANDAS may have limited ability to attend to specific academic tasks because the disorder causes them to be overly alert and may cause distractibility during instruction. It may cause them to have difficulty with organization. They may have difficulty paying attention and inability to focus. They may have difficulty maintaining positive social relationships or work with peers, and they can be impulsive. So to me, when I see this for OHI, I'm like, this is our PANS and PANDAS kids, at least for mine. It definitely describes them. So now you have a better understanding of a 504 and an IEP. So let's get an understanding of the referral process. So after you request a special education evaluation, remember that email that you're going to send, The school psychologist will ask them to sit down and meet with you. They will ask you to state the reasons you believe your child has a disability. This is when you can get into the symptomology of PANDAS and really describe your child to a T. I'll describe my child, but you can then change that. So you might describe the heightened sensory processing response, maybe their high anxiety, their obsessive compulsive behaviors, their irritability and moodiness, inflexibility. Maybe they have headaches, urinary frequency. Maybe they still stay ill longer. Maybe your child has physical aggression, separation anxiety, panic attacks, rare but sometimes hallucinations, inconsistencies with math and literacy. Maybe they're less persistent with academic tasks, all of which definitely affects their learning, and they're much different than their peers. Then they'll ask about information about academic and pre-academic achievement. This is where the teacher will probably present district-wide assessments, any sort of screening they've done as a district or state assessments, or any anecdotal notes that they have on your child. Then the psychologist will ask about functional performance. This is where you want to discuss how your child's everyday functioning is impacted because of their PANS and PANDAS. So maybe you go into their emotional regulation and control, maybe their difficulty with focus and concentration and what that does to them. You can talk about family relationships and interactions, so they really get a good picture of what's happening. You can also talk about the ability to access community or not access community activities, self-care, what that looks like, and regulation, maybe their sleep, and their feelings of wellness or not feeling so well, like headaches and stomach aches and shoulders and neck pain. Again, those are kind of examples of my daughter. Or temperature dysregulation. Then they'll go into and ask more about the medical information. This is where you can talk about the diagnosis, maybe the onset age. Again, you can list more of those symptoms that we talked about. If you have a doctor's letter, this would be a great time to share it here. If you don't, that's okay, but if you do, this is when you could share it. Then they'll ask you about any special programs or services that the child is currently using. So maybe there's medical treatments for PANDAS that you're doing right now. Maybe they're going to a counselor, a psychologist. Maybe you're in OT or PT for their body and to help them with movement. And the teacher then can talk about what they're doing in the classroom to help as well. At the end, they'll talk about some assessments that they would like to do with your child. If they don't mention a functional behavioral assessment, I would suggest that that would be something that you would request for. So now you've asked for an evaluation, you've sat down with a psychologist. Now the team of educators will go ahead and they'll evaluate your child. The team will decide further evaluations to see what they can do then to help your child with education. You will of course need to give consent to these assessments and evaluations. And usually it takes about 60 calendar days from your consent. And then the team will then reconvene and discuss the determination after all of the assessments have been given. You will probably be asked to fill out a bunch of scales and assessment forms rating your child in certain areas. So following this evaluation and your child's assessment, you will have a meeting to determine eligibility for special education. They'll sit down with you and they will review the evaluation and all the testing that they did. The team will then discuss what the child needs to do well in school, including specialized instruction. At any time, you can always request changes. Once you have an IEP or 504, you can always request changes to that. And you can advocate for more testing. In my opinion, the most stressful time is this meeting right here, this meeting at the end, where they're going through all their assessments and their data. Okay, so just be ready to really sit down, and it's about an hour, hour and a half sometimes. But the whole team will get together. They'll hand you a packet of all of the data and all the information, and then each educator will explain the assessment that they did and what they found, their data and their conclusions. And each educator will talk and explain those findings. So it can be kind of long, but it also can go really quickly. And you may want to know right away if they qualify for that 504 or for that IEP, but that usually comes at the end. So just listen, take notes, ask questions. So all states have to follow the federal law, and some states will have less stringent eligibility criteria, which would be good for you. Um, Come to this as a team approach. Like, all of these people at the table really want the best for your kid, but you as the parent, your input is invaluable. So speak up. Be prepared really to work to get what your child needs. Ask for questions for clarification, because sometimes the information they present to you is confusing. Bring a support team with you, with your spouse or a friend or someone that will be just sitting next to you to support you. Whatever you do from the beginning of just sending that letter to any conversations you have through the end, always keep a paper trail. Follow up with an email with whatever you talked about, so it's there and you can always bring that with you. Review whether they do a 504 plan or an IEP, whatever they decide on. That is something that you need to review before you sign it. And it's okay not to sign the paperwork today at this meeting. You can always take it with you and read over it and ask questions, and take the time you need. During this meeting, it is long, so you can take a break whenever you need to, especially if you start to get emotional. It's okay to take a break and ask for that. Stick to the facts, and data is your friend on this one. Know that the team members cannot be absent in whole or part of the IEP meeting. They would need prior written consent, so they all have to show up unless they have consent not to. An IEP and 504 is a fluid document, and it's driven by the student's needs. So whatever is decided at the end of this meeting, it can be changed. An IQ, so if they do IQ testing, just know that that does not mean a child is capable of doing what their IQ shows. So we really need to consider developmental appropriateness when we're considering placement and what would they need. So here are just some fun facts for you. A medical diagnosis is not a necessary nor by itself a sufficient criterion for establishing OHI eligibility. If considering OHI, the team should review medical and health records. And here you do not have to sign away your rights for the school district to have access to your doctor. You can just give them the records that they need to see. A medical diagnosis, however, is helpful in determining eligibility and educational needs. And here on the right side, a child with passing grades is eligible for an IEP. So this is important because our child, her 504 is serving her very well, but we decided to try to get an IEP. And in the end, they had said that, well, because she's proficient, she doesn't qualify. And I agreed to that. And I probably shouldn't have, because after that, I learned that even if they have passing grades, they're still eligible for that IEP. So at the beginning, we talked about sending that letter in to ask for a special education evaluation. You can just take a screenshot of this. This would be, a sample letter to ask for a special education evaluation, and you can use it as you want. It's a little wordy, so you can take things out that will fit your needs and your child's needs. Here are the references that I use. Again, your state's Department of Public Instruction is such a great those are great websites and references that you can use. And aspire.care, obviously it's great, and I use a lot of things from there. And this is the end of our presentation. So thank you.
Thank you. And I think that sample letter is on the site, because when we were doing all those sections, we did a couple of sample letters. So I think there was requesting a 504, requesting an IEP, a couple other things.
Oh, okay. I didn't know that it was on there. Perfect.
So,
okay, great.
And they're really just samples. So like, we don't have sample letters for everything. Some doctors are really great at editing and changing a letter for each student. And some doctors are frankly absolutely resistant to doing it. So you just have to ask. And sometimes I have found you can say, well, perhaps if I drafted it and sent it to you, you could change it to how you feel comfortable signing it, because they also have to sign it. But they're busy too.
They're busy, but if you do that draft, it's a perfect thing, especially
it
if you
really
have a
helps
good,
them.
yeah,
Yeah.
a good
So like,
relationship with them.
and it really fine tunes it to your kid, but that's a perfect world. Um,
Yeah,
and
right.
as far as the free educate or the education training for IEPs, that's one of the things we do a lot at Aspires. That is how, even though we publicize that we have in-service webinars and you can say, look, can you do this in-service webinar? We can do them outside of IEPs. Usually that's a bigger group, but we do a lot of just individual, and it's not about your student. It's, the overall about PANDAS, and it's very long to be pretty broad and sort of get everybody in there, but we really go through the medical to explain why we have these choice-based and not choice-based behaviors, and then the importance of all that and why it happens, so that we can set everybody up to explain the behaviors at school, the attendance issues at school, and all the different things that we deal with on a different daily basis. And then I just wanted to make a note about the plop, because like I'm very invested in plops.
Yes.
Who doesn't want to say plop every few minutes? It's just funny. So obviously I have a kid with autism, with PANS, but I also have one with autism and PANS, and we've been doing special ed since they were 3 with both kids and in and out, and they're very different. So, one is really low functioning, one's higher. And so I've sort of seen the gamut of how things are done and being denied an IEP, requesting things. So the plop, that's really, I stress that you guys as parents are so important to that team, and come prepared. I know Shara's definitely said come prepared, but for me, the things that I do to come prepared is everything I think my kid can't do that's on grade level. So that may be something they could have done a month ago, but then the flare put them not able to do it this month, or maybe they haven't been able to do it for a really long time. It doesn't matter. It's their present levels of performance. And so it's not the most fun part of your day, writing all the stuff your kid can't do. You're like, but it's important. So like when you can even pull out old classwork or whatever and say they can no longer do this. And so you just list like math class, you chunk it out however you want, like academically, behaviorally, socially, or class by class, however it makes sense to you. And a lot of those will overlap. And so you sort of fine tune them so that it's hard. We don't always know if it's a processing speed. So you may not be able to assess that as a parent, but maybe you can. And my sort of rule is for everything that they can't do that's listed in that final plop should be a goal.
Right.
Because whatever you're writing in that IEP meeting is going to drive services. So goals drive services, goals drive placement, goals drive everything. So you've got to have the goals. So the things that they can't do are the things that the school should be working on. So they cannot advocate for themselves. They can no longer add 2 + 2. They can self-regulate, and they don't know when they need to jump up and leave the classroom type of thing. And then they have the meltdown and things get worse. So we want to cut them off at the pass. So like they should have a goal for each one of those things that they can't do in their plop. That's just one of my things about plop. Easier said than done, of course. But
of course. Yeah. But I think too, working with the classroom teacher about like what's happening academically, because of course you're not going to see everything for that present level of performance in terms of academics.
Right.
The social emotional, you may see that, but really getting those work samples and asking them to provide that for you would be really helpful.
It's really important. And then and don't let schools pass you off if they say, oh, we don't see this at school, this is a you problem, only at home, because they have been in school all day. And if they even say something like, oh, but we've never, it must be you, we don't, this literally happens all the time with autism families. These schools know that this happens at home. Don't let them act like, oh, it's different because it's pants. Like this literally is not a different thing just because of pants. Kids lose it once they get home often. If they're holding all day. So this isn't something groundbreaking for teachers. And so don't let them foff it on you. Just like they need to lower the expectations during the day. through accommodations and modifications, depending on what fit.
Right.
And anyway, so let's look at the questions. I think I closed that out because when I was.
And I would love to eventually, depending on who else you have to present, would be really, I know I get a lot of questions about like, well, what kind of accommodations and
Right.
modifications should we have? What does that look like to help a student with, dysgraphia, or they're
Right.
processing they're having a hard time with memory and processing information.
What are all the different things? I know
Yeah.
Patty Doran, who wrote one of the books on PANDAS at school, sort of the Bible on school. She
Yeah.
in, I think it's November.
Perfect.
But I think that will be more broad strokes about, working with the behaviorals and um, the absenteeism and all of that. Not 100% sure. Because you and I discussed that a little bit, but yeah, so
Mhm.
definitely come
Yeah.
back and really dig deep into a lot of those accommodations on the sort of day to day. Because, there's sort of the broad ones that can be used across grade levels and then the more specific ones. So let me look
Right.
at some of the questions. I know a lot of the questions that got sent to us, she incorporated or already had incorporated
Yeah.
into her talk. My IEP team won't add OHI to my son's existing IEP as a determinary factor. They want me to talk to the school psychiatrist, even though we provided a letter from his doctor that he has PANS. And he's also has Lyme, so he's pretty much in a constant to worsening flare.
Well, I guess I would say, your IEP can have two disabilities listed. So I don't see the problem with doing the OHI, but that sounds like you would probably need to go through another reevaluation to get that OHI tacked onto the IEP. And so them asking you to meet with a psychologist, that's like what I just went through, going from the beginning again. And so you're going to have to do more assessments then to qualify for OHI.
Yeah. And talking to the school psych is pretty routine anyway.
Yeah.
School process. I mean, it's sort of just one of the things you have to sort of do because they, like
Right.
you said, they're sort of often the lead in a lot of.
They are the lead, and often, and with your IPs, and you have to by law reevaluate every 3 years, right? I mean, but you can do it every once a year as well.
Right.
So
And then there's asking for an independent assessment, which you didn't get into, but there is also that.
I didn't get into that. I didn't, because I always found like whatever assessments you brought in, the school district likes to do their own because they're so academic focused, of course,
Yeah.
because they're schools. So, but it does give it good information to kids too. So I'm sorry I didn't touch on that. Maybe I should have, but
Right.
that's why I didn't.
Yeah. And and not every kid is chronic. And so when they're need a more fluid in and out of services, hitting them at the right time, getting that lined up with when you meet with that neuropsych or whoever the independent evaluator is, and getting the right time versus like, where's their baseline? What are we testing at the worst? Can we even get you in when they're non-functioning or lower functioning? And it's hard to manage that. But basically with an IE, really, really briefly for those who are listening, and it's on our site, and she gave you resources like Understood and some of them that break it down really easily. But once the school does an assessment, you at that point either agree with the assessment, and then with that assessment they give recommendations. So there's two parts to that, and you can agree to one or both. So if you think the assessment is basically okay, but their recommendations, you're like, no, I don't agree with that at all. That sets also a whole other process. But part of that process is at that point, you can say, I'd like another set of eyes on that. And I'm requesting an independent assessment, an IEE at taxpayer expense. And either the school will say yes or no. And if they say no, it sets off due process and this whole other thing happens. And it sounds scary, but it doesn't have to be. Can be also a good bargaining chip. I've noticed. And then if they say yes, you get an independent assessment. The school district will try to give you, or they will give you a list of people they think are independent. My advice as a parent, been doing this for 14 years, get somebody else. But that process can take a very long time because they're busy, they're backed up, there's so few of them. And so that may not happen for I mean, it could be 8 months in certain areas for different, so you need to have a plan in place in between, um, which isn't always fun. So in IE, they sound great in theory, but getting them to actually work and lining up well is difficult. And they may come up with a different plan for the school. But like Shara said, just because they say one thing doesn't mean that you can't keep talking about it, with more information as you go along. So just think of it as a living document and a living process and just keep going.
Yeah, but and also like what Gabriella was saying, it's good to have a plan in place. So either that 504 IEP, while then you're trying to gain more information that will then help with the reevaluation of that IEP,
Right.
because they need to have they need to have support.
Yeah.
While
So
that's
like keeping a log, like any day that they're out, like what precipitated that, like keep it all going, like so that, it's hard enough to get an antecedent of a behavior with these kids because that brain-based inflammation, sometimes there's like no antecedent that you can ever figure out. But if you can, you keep notes and just keep notes of like, she struggled with this, and this, and you sort of keep your own paper trail to be that part of that IEP team. Um, so you've made it all through lower school and elementary school and you hit high school and the bottom falls out. Is it the same approach or is it a different approach for high school? Or do you have different words of advice for high school?
So we've never personally went through went through high school, but it is the same. It's the same process, just like what we went through the presentation. It wouldn't be any different than what a kindergartner would need to be evaluated.
Right.
Maybe you have more information because you have older kids.
Yeah. Legally, you're right. It's 100% the same. It feels like the stakes are a lot higher as you get closer and closer to that D-Day of graduation or not graduation.
I would say though, the great thing about the 504 is that it does carry through higher education. If they're seniors, just something to consider.
Yeah.
Yeah.
Every school is going to have because it's a federal law, but how each college or university handles that is going to be very different, and which office handles it, and that I don't really know much about, but I just know that like it's a different process and like something you should start early because sometimes they want a different assessment or something else, and different programs. It's just going to depend on the program, and some schools are better at it. They are, and some schools are just hopeless. So having to research all of that is never that easy. But as far as high school, like you did mention in the modifications pass fail, and for us personally, for one of my kids, that was sort of the lifesaver. We did that through a 504 though. We didn't do that with an IEP because it really fell into that typical 504 category of lowering that busy work, like lowering the amount, but still getting there at what the curriculum specialist says you need to be at the end of the day to graduate, to get all your credits. But by going pass fail, they can kind of lower it even more because the bar is lower. So you're still having to pass. So therefore the curriculum is staying. So it's not a modification in a way. But you need, for us, having a good guidance counselor managing all the teachers was really critical, and having her be on our side. And that's not always possible because some of them aren't as built like that. But some are, but we found her to be really a great case manager. She's like, well, I'll get on the phone and say, look, is he passing? Like, because we don't really know about this math. And they were able to sort of figure that out like mid-semester too, like suddenly shift gears, but it did help a lot with the stress. And remember that psychosocial stress is a trigger for PANDAS. So when we get to those high pressure points like finals, huge projects, you want to anticipate as much as possible, plan for the worst, hope for the best, and talk about those options ahead of time, like the pass fail, like what paperwork and when does your school district require that trigger from whomever in your school staff to pull a pass fail, so that you sort of know. And I don't know how many parents have said, yeah, but then it doesn't look good on his GPA. And I was like, yeah, but failing and not getting credit looks worse. So, you know, it's not perfect, but it was the sort of thing that kept, I know it keeps a lot of kids going because they feel that they're still in it and they can still graduate and they can still do other things to pick things up and you know, figuring it out. So there are different options, but for high school, that was one of the bigger ones.
And when you talk about the stress and how that can bring on flares too, for I'm sorry, this has nothing to do with high school. It can though, but we choose to opt our children out of the state assessments that we
That's
do
true. Yeah.
because it can just bring on a flare big time, and it's not worth it.
No, I
So,
mean, they really don't. They don't
yeah.
really. They always say, "Well, it's good practice." I'm like, no, it's not.
No.
It's odd. Yeah, I don't know.
Okay.
Then what is the benefit of an IEP over a 504? Like, are there certain just legal triggers that are better for one over the other?
Well, I think a 504 is probably less restrictive than an IEP. It can be pretty broad, where like an IEP is probably a better option for students where their disability is really adversely impacting their education. I mean, an IEP is, like you said, with that plot, it can be so specific with their goals and how those goals are going to be attained that I mean, that is the big difference. Where 504 is a little kind of like, it's just like this plan with these accommodations and who's going to do it, but it's pretty broad.
Yeah,
But the IEP is very specific.
and much more traceable and accountable and measurable.
Very much so. Yeah.
Because the goals have to be measurable at certain benchmarks, so you
Right.
know what's going along.
Right. And it's reviewed, and you know, it just depends on your kid what they really do, what they really need.
Yeah. And you know, one is a special education law and one is a
Right.
civil rights law. So
Right.
really, you know, you're dealing with two different things.
Yeah.
And you spoke a little bit about absenteeism, but do you have any other tips for handling truancy filings?
Oh, and assuming they have an IEP or a 504.
Doesn't say.
Okay, so we assume that they probably don't. Maybe. Well, I would say
A lot of people have 504s, but nothing really very protective about the
with the attendance.
attendance. I find that's the part that the schools
Oh,
balk, you know, so it doesn't get written in as well as possible.
okay. Well, I would say that I mean, the school district has to go through so many steps, right? But they have to file for truancy by law, right?
Mhm.
But I have my administration degree, but I'm not practicing. But I can say through some experience and what I know that if a school were to go in front of a judge and say, okay, and explain the situation, and the judge says, so what have you done to try to remedy the situation? And now they know that this child has some medical needs. This judge is going to throw it right back into the district's face and say, get back there and figure out a way to make this work.
Right.
Of course, you don't want to get to that point, but the school district is supposed to be trying to work with you so your child isn't truant. And so once you describe even more about what's going on medically, if they haven't already, that should probably be a perfect time to have an evaluation
Right.
for special ed. And then
And
hopefully wouldn't go to court then.
yeah, I've sat in on a truancy court thing, whatever procedure
Yeah.
before, and a couple of times for other things, and really taking a calendar day by day of each time the kid missed and very clearly writing out why they couldn't be there
Right.
and how either that matches with their 504 IEP or the fact that you requested this help on their 504 and IEP and the school denied you, and hopefully you have a letter from the doctor, because this is where a doctor letter really is important, talking about those attendance issues. And
Right.
excusing them to some degree, or completely, depending on the case. But having that doctor letter is very important, even if it's retroactive. I mean, you want to say, it took me a while to get the letter because, as we explained to school districts, it's not that easy to get into your doctor to begin with. My advice always, basically in May, is make your appointment to go back to school with your doctor and get that fresh letter for attendance. Get that appointment in for August or something like that.
Right, bring it in with you, have them sign it.
Have it the first day, or soon, say, I'm coming. And
But some school districts have a different policy for what is and what is an absence. Is it 5 minutes past the bell? Is it,
right.
So getting to know those, that policy and that in your district will also help you, so you can plan it into your IEP or your 504.
Right. And that should be all written out in policy. So if a school district ever says, well, that's what we do, and you're not really sure that's policy, attendance always is policy. Everything's pretty written clearly. You won't run into that trouble here. But if they do come at you with anything else and say, yeah, but that's not what we do, say, well, I'd like to see that written. So show me where that is in the handbook written as policy. Because if it's not written, it's not policy.
Right.
But really keeping that log, if like you're going into why they missed, how they pissed, and how the school didn't do their job. Either they rejected your first request, or they didn't follow the 504 and IEP. That's what we've
and
done.
that's why I had mentioned too, when I was speaking before, about really creating that paper trail. So for this parent, if they have emails back and forth between teachers and principals about their child being absent, and them explaining why and the reason, all of that will help you in the end, and hopefully you won't have to go in front of the judge and
Yeah, they don't want to do it either. It takes their time.
No, of course not. Yep.
Avoid it as much as possible.
Yeah.
And some people have had to do a homebound for a while. That definitely takes a doctor letter and is outside of your 504 and IEP plan. A lot of schools are pretty rigid on that, and they want you to be out of school the whole time. But then trying to work with them, sometimes it takes having a lot of finesse, saying, well, wouldn't it be better if they were in school part of the time?
Yeah, isn't it better to try to transition them into the school day?
Right.
We want to be able to do those things.
And that tastes like deep zen to get through those. Okay, so there's another question, and it doesn't give you a lot of specifics to work on. And I know we mentioned that you're gonna do another talk on accommodations. So I don't know, maybe you could talk broad strokes. My son already has an IEP and is in a moderate severe separate classroom. It says SDC, so I assume that's a separate classroom. What can I add to the IEP?
Oh, that's hard to answer, isn't it?
Yeah.
I just don't. It's like, yeah. Oh, I don't know how to answer that one, Gabrielle. I'm sorry. Without really knowing, because like my child is with her PANDAS is so much different than other children. Like she had very specific needs. Like she had these high temperatures. Like, so we had fans and she had ice packs, and she had a really sore neck all of the time and achy body. So we had all those like accommodations put into her 504. And then specific learning ones as well. But it's really hard to just, without knowing the child, know exactly what they would need.
Yeah, it's really going back to that plop.
It really is.
Yeah,
I mean, it really going back to what they need, what are they doing now, and then what's our goal?
Right.
What do we want them to get to, right?
Like where, in working with a teacher, where is that breakdown in their day? Like, are they always breaking down an hour before lunch or an hour after gym or something, and trying to figure out, are they breaking down before lunch because they're hungrier earlier, or because they have heightened anxiety around that social situation and know it's going to be loud, if they have the sensory, and sort of trying to tease it all out and saying, all right, well, let's spend some time figuring out why this meltdown happens at 11 o'clock every Monday, Wednesday, Friday schedule versus later on Tuesday, Thursdays. And sometimes that'll be the thing, like they modify that day or they accommodate that day. But it could be that they need an aid to themselves. It may mean that they need, their sensory issues are so significant that you actually need to get the occupational therapy services to help calm. Like, it's really going to depend on your kiddo, because if they're in a mod severe classroom, we're dealing with some definite behaviors here. So, really, working with them to understand that brain-based neurobehavior, brain on fire behavior versus choice, and where you're going to push it and when you're not. And
And is
sometimes
that setting appropriate for that student? I mean, I'm assuming some things are happening for that parent to then ask that question. So maybe it isn't the least restrictive environment. Maybe there's things going on in that classroom that's really affecting the student too. But yeah, you're right. It's kind of like and you have to investigate. You're like a detective with the teacher to really figure out the patterns.
right. And least restrictive, it's always a tricky word. We go from general ed with some help, general ed with a little help, to self-contained. And then what's happening in that self-contained is going to have its just degrees of least restrictive. And
Of course.
sometimes not providing enough help is actually restrictive. They're like, oh, we're not being restrictive because we're not helping them too much. They're doing it. Maybe that's actually restricting them
Oh,
because they need more assistance, type of thing.
right.
So, you can sort of throw it back on them and say, well, it's sort of like, it's still restrictive because it's restricting my students' ability to proceed with their curriculum and their day. I don't know. Do they have to test if you request it?
Yes, you can make requests from the school district for any assessments that you would like to have that they do.
Yeah. And
Yep.
on the Aspire site there, it doesn't give specific names of tests, but it gives you different avenues to be looking at, gives a whole group of them,
Right.
which I can't really speak on specifically because I haven't read it in a while.
Yeah.
But yeah, they need, I mean, and you have to sign off the permission. I mean, the testing has to be able to be done by their people, and
Right.
you can still always get outside testing after that.
Of course. But yes, they do. Yeah. You can request that.
Yeah, because it's all part of something called Child Find, and they have to they have to establish that they have done enough looking into finding the problems with your child. I don't know
Right.
exactly what, so there's a process that they're required to go through, like as she
Right.
said in her talk.
Yep.
And Shara, thank you so much for speaking
Thank
today,
you.
getting us all sort of squared away on how to start this process of exploring 504s and special education. And we look forward to having you come speak again, specifically on accommodations and everything like that.
Thanks,
And thank you
Gabriella.
to
Thank
all
you.
of our attendings for being patient through the little weird Zoom webinar glitches. We gotta love technology. It all works in the end,
Of
right?
course it had to happen.
Uh,
I was
anyway.
just speaking to myself in my room.
Yeah.
It's oddly therapeutic. It's okay. I'm sorry for making you guys go through that and wait.
It's all right. We've got it figured out pretty quickly. All right. Thank you so much. Have a
Thank
wonderful
you.
day. Bye.
Bye.